I know that you've had some very hard times lately,
Sabemos que has tenido tiempos difíciles últimamente
and I'm very sorry.
y lo lamento mucho.
I prayed for Jose when he was sick,
Estuvo rezando por José mientras estaba enfermo,
as I prayed for you.
así como he estado rezando por ti.
Yes. So he provided, through his job, he provided insurance for you, and now you have no insurance.
Cuando él vivía, él tenía seguro y tú tenías también ese seguro.
And the disease you have is what is making it difficult to talk.
La enfermedad que tienes ahorita ha llegado también un poco a la garganta y eso lo dificulta, ¿verdad?
Yes, yes. So now, when you need health care, you have to go to a special clinic.
Cuando tú ahorita tienes algún problema de salud, tienes que ir a alguna clínica diferente o especial que la que tenías antes con José.
Sí, tendría que ir a otra.
Yes.
Yes, you have to,
Go to Hacks.
yeah, to another one.
Right. Because she has no insurance.
Sí.
Yeah, no insurance. And you can't get insurance right now.
Y ahora no puedes conseguir ningún seguro.
No.
No.
But the children have insurance through Medicaid.
Todos tus hijos tienen seguro por mí.
So today we're going to go see Dr. Hamill.
Hoy vamos a ir a ver al Dr. Hamill.
And he will give you an exam
Te va a examinar nuevamente
and medications.
y darte los medicamentos que necesites.
Gracias a Dios.
What did she say?
Thank God.
Yes, see. Yeah, we've been praying for you. And Dr. Hamill and Dr. Curry are very concerned.
Que todos estamos al pendiente de tu situación.
We want to help you get care.
Queremos ayudarte a que consigas tratamiento porque ya es urgente.
Yes. And Kimberly's able to get care, right?
Kimberly sí tiene cuidado.
Tell me some of the challenges of going to the clinic.
¿Qué dificultades has tenido para ir a la clínica?
Pues ninguna, solamente que ahorita el problema es con la medicina.
Okay. She has really no challenge getting to the clinic only to get the medication.
Okay.
Sí, porque pues con el doctor siempre voy. Pero el problema es para agarrar los medicamentos.
She knows she can go to Dr. Hamill, but the difficulty is getting the meds.
Okay. Even when she sees Dr. Hamill?
Aun cuando vas con el Dr. Hamill es difícil conseguir la medicina.
Sí,
Yes. Algunas, yeah, sometimes.
Sometimes.
porque el doctor me da, bueno, en la clínica de él, me dan la calitra.
Okay.
Sí, pero pues las otras no.
Okay, because in the clinic in Hacks,
No, en la clínica de él, allá por el hospital.
okay, in the private office of Dr. Hamill, they give them the Calitra, like our free samples, but not the other meds. She has to buy it.
So you take your children to school every day
Llevas a tus hijos todos los días a la escuela
and pick them up.
y los recoges.
Yes. And Kimberly's not yet in school.
Kimberly todavía no va a la escuela.
Yes. All right. Okay. You need some
¿Quieres
water?
agüita?
Así que agarra así.
Take your time. No worries.
Duele.
Sí.
It hurts. Right?
So, okay. We can take our time. Does she need water?
¿Seguro que no quieres agüita? Si quieres tomar tantito, no.
Just hot? You want to turn the fan on?
It happens regularly. Sí. Oh, she has no cough.
If she takes her meds, she's going to be okay.
Oye, Kimberly, ¿tú tomas medicinas?
Sí.
Sí. ¿Cuántas?
Muchas mira.
Muchas. She says she takes a lot of medicine. ¿Pastillas o jarabe?
Pastillas.
By oral? I mean, liquid.
No, no liquid.
Swallows the pill?
Yes.
Oh, that's very good.
Ya toma pastillas, Kimberly.
¿Para qué?
Pues para la enfermedad.
Oh, sí.
Sí, ya no es puro líquido.
Toma líquido, pero tiene una pastilla que es está en un, ¿cómo?
Está en estudio o algo así. Oh, okay. She takes one pill like it's in an experimental study.
She takes one pill and then
Yeah,
what?
it's in a study. In an experimental study. Yes.
The reason that you don't go see Dr. Hamill is because you can't get the medications you need at his office?
Sí, la razón por la que no vas con el Dr. Hamill es porque sabes que cuando vas a ir a veces no obtienes la medicina.
Esta mi mamá me da la vicina.
Sí.
Oh, that's your medicine. Okay, very nice, Kim.
Okay. And they can give you one medication, but you have to buy the others.
En la oficina del Dr. Hamill te dan una medicina, pero tú tienes que comprarla además.
Sí, ya todo lo demás.
And the other medicines are very expensive.
Son caras.
Más que todo una de las que me dan
Ujú.
por la enfermedad
Okay,
VIH es bien cara.
okay. One of the meds for the HIV, it's too expensive, she can't afford it.
Yeah. When you had insurance, insurance would help pay for some of that?
Cuando tenía seguro, el seguro pagaba todas esas medicinas.
Okay. All right. Tell her we're hopeful then at Hacks we can help her with these other meds.
Sí, esperemos ya que en Hacks todo eso se lo solucione y tú tengas todas las medicinas otra vez.
You also work in a clinic here in town called Houston Area Community Services?
Yes, that's a federally qualified clinic. Originally, it started as a clinic's mission was to take care of HIV-positive monolingual Hispanic patients who had trouble getting care.
So they came there because they were uninsured?
Yes,
Okay. Is HIV care expensive?
very.
What,
Well, it depends. It's expensive to treat, but if you don't treat, it's more expensive.
what do you mean by that?
Well, patients get sicker, and the sick patients end up in the ICUs dying, costing far more than if they had stayed on their therapy. And patients who are healthy and on therapy work and have jobs and normal lives. People don't understand that.
If we can get an HIV patient on their medication, they can go back to somewhat normal life.
Yes.
Yeah. And if we don't, then they become
If we don't, then they go down this spiral of getting sicker and sicker, and then eventually dying slowly.
What would a patient's drug cost be for a year? How much?
At least $10,000 a year, minimum.
for HIV treatment?
Yes.
If they were to be admitted to an ICU,
Now, if they were admitted to ICU, that's thousands of dollars a day.
That's what I'm
You
getting
can
at.
easily develop a bill up to millions of dollars. And I see a lot of pregnant HIV patients, about 100 a year. And although the transmission rate is low, if you have an infected baby and they don't take their drugs, 90% of those die by age 4, a slow death at the cost of about $1 million.
what are some of the hardships your patients face, the ones who come to HACS, the Houston Area Community Services?
Well, many of them are monolingual, so they have trouble accessing the system because of language barriers.
Okay.
You know, you go in some clinics, people just talk louder in English, the usual approach. The other problem is many of the women I see have families, and they may take their medicine while they're pregnant, but then once they deliver the baby, they'll take care of the baby, they'll take care of their family, they'll take care of everyone but themselves. And then the other thing is, Houston isn't like New York City where they have subways and buses, and if you ever try to take a bus to get to the other side of the city, and then on top of that, you have a baby on your knees and a toddler, it's just getting around is hard, let alone how to pay for the medicines. And then take the drugs. We think it's just a matter of getting the drugs and swallowing them.
So they face not only the barriers of childcare, but then also transportation, because our transportation system doesn't support our patient populace as well.
It's not easy.
Yeah, it's not easy.
And I've always been impressed that many of my patients will almost crawl to my office, but they make it, especially while they're pregnant.
I'm going to be visiting one of your patients tomorrow.
Yes.
And it sounds like that's kind of been some of her struggle is she's taking care of more of her children than she has been taking care of herself.
Yes.
What's going to be the result if she doesn't get treatment?
She'll die. She'll leave some orphans. Gretel. Un momento. Otra vez. Solamente abierto. Saca la lengua. Dice, problemas aquí o dentro.
So you're seeing a lot of patients in here every day who are uninsured, is that
Yes,
right? In fact, I guess.
most of our patients are uninsured.
Okay. What's the single greatest obstacle an uninsured patient has to overcome to see a physician here? What are the obstacles, or might be more than that?
I think some of the biggest obstacles definitely is transportation. Many of our patients are Spanish speaking only, or they speak other languages. They speak Burmese, they speak Swahili, and they are unfamiliar with Metro's system. Once they're able to figure it out, it becomes easier, but I think transportation is obviously the biggest barrier, as well as going through the eligibility process. No matter where you go for care, you're going to be having to provide copies of your ID, proof of your residency, which it can be difficult for undocumented clients, obviously, proof of income, if they have no income, a supporter statement. There's a lot of paperwork and a lot of things that they have to do before they can actually sit down in the exam room with the doctor.
We are seeing some changes in healthcare today, and one of those changes that we're working on as a nation and as an industry is the uninsured person. So just succinctly, give me some ideas. How have you seen the uninsured person affect healthcare at Woman's, and maybe even in a big picture way?
Mm-hmm. Well, you know, when a individual does not have health insurance, they usually put off going to a physician because they don't have the money to pay for it, and they put it off and put it off until the condition really becomes serious. And then a lot of the people enter through our emergency departments. And that is the most expensive way of providing health care. So if we can just find ways, I think, of getting the person to the doctor before it gets so serious and it is an emergency, we can really decrease the cost.
Oh.